Okay. My name is Michelle Alexander.
I'm Natasha Hall.
And I'm Desiree Smith.
And we are going to demonstrate CPR to you all today. CPR is a life-saving technique useful in many emergencies, including heart attacks, near drowning, and in which someone breathing or heartbeat is stopped. The American Heart Association recommends that everyone, untrained bystanders and medical personnel alike, begin CPR with chest compressions. It's better to do something than to do nothing and let somebody die.
Before starting CPR, check if the person conscious or unconscious. If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, one should call 911 or the local emergency number, and one should begin CPR. If you are alone and have immediate access to the telephone, call 911 before beginning CPR, unless you think the person has become unresponsive because of suffocation, such as drowning. In this special case, begin CPR for 1 minute and then call 911 or the local emergency number. If an AED is immediately available, deliver one shock if instructed by the device, then begin CPR. Remember to spell CAB, compressions, airway, and breathing.
CPR can keep oxygenated blood flowing in the brain and other vital organs until more medical treatment can restore a normal heart rate rhythm. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die within 8 to 10 minutes. To learn CPR properly, take an accredited first aid training course, including CPR and how to use the defibrillator if you are untrained and have immediately access to a phone, or call 911 before CPR. The dispatcher can instruct you in a proper procedure until help arrives.
Okay, before we get into our demonstration, I would like to ask, does anybody know why CPR is important? Why knowing CPR is important?
Well, it would help save a life, and it'll give a person a second chance on living if somebody gives them CPR.
Okay. Anybody else?
I like to say hope. Okay. Well, what about it? No.
Somebody.
I'm getting hurt. Joe, do you know anything about CPR? Can you help us out, please?
Does anybody know what CPR stands for?
What is it? I don't know how to pronounce that C word.
Cardiopulmonary.
Cardiopulmonary Resuscitation.
Okay.
Okay. Well, what I have here, I made a brochure and a little pamphlet that I'll pass around and we can read together. I don't know if I got enough. Y'all want to share it? Y'all each want y'all.
Name.
All right. Cardiopulmonary resuscitation, knowing the basics. Cardiopulmonary resuscitation, also known as CPR, is a life-saving technique useful in any emergencies, including heart attacks, near drowning, or in which someone has breathing or heartbeat has stopped. CPR can keep oxygenated blood flowing to the brains and other vital organs. When the heart stops, lack of oxygenated blood can cause brain damage, and a person can die immediately. Before starting CPR, check the level of consciousness. If they appear unconscious, Shake them, tap them loudly, and ask are they okay. If 2 people are available, one starts CPR and the other one calls 911. Performing CPR, we're going to do CAB. So we're going to start chest compressions, then airway, and then breathing. And you're going to compress the chest 30 times, give 2 rescue breaths, and then go back and forth with that. So compressions and airway and breathing. Proper hand placing while performing CPR is crucial. Use the heel of your hands and compress the breastbone at the nipple line. Depress the sternum about 1/3 to 1/2 depth, depending on the person's size. And remember, when performing CPR, use CAB, compression, airway, and breathing.
Anybody have any questions about that? Regarding that information? No? Okay. I am going to show you our poster demonstration.
Thank you.
It's pretty much the same thing that she just described, but it has pictures involved. So before you would even begin CPR, you would check level of consciousness. You want to make sure you ask if they're okay. You shake them. You see the lady? Okay. So if there are 2 people around, you want to have the first person go call 911, and then the other person would start the CPR. If it's only one person around, then you would call 911 and then start CPR. When performing CPR, you want to remember CAB: circulation, airway, and breathing. 30 chest compressions. You're gonna go back and forth between the 30 chest compressions and the 2 rescue breaths. Airway, you want to make sure that you open up the airway by lifting their chin up, like this, and make sure you do the finger sweep to make sure there's nothing in their airway. It's best to use the pinky finger because it can get in smaller places. And the breathing is the rescue breath. So what is most important is circulation. So that's why you want to make sure you do the chest compressions first. So the order of CPR is chest compressions 30 times. And then you give the 2 rescue breaths. Open airway and give 2 rescue breaths. Compress chest 30 times. Continue cycle of 2 breaths and 30 compressions. And after 5 cycles of actual CPR, if they're not showing any signs of life, you will use the AED. But we're not demonstrating that today. Or you would just keep doing it until the emergency people arrive. Okay? And so now Natasha is going to demonstrate the correct way to do chest compressions.
So you will properly place your hands one on top of the other at the sternum. Keeping your elbows straight, you will compress it 30 times, about halfway down, depending on the size of the person. I'm not going to do it 30 times, but y'all know it's 30 times. 1.
And you want to make sure you're going in a nice steady motion, because you're basically trying to mop their heartbeat when you're doing the chest compression. Anybody have any questions about the correct way to do the chest compression?
Okay. How fast are you supposed to do the 30 compressions?
You just do it in a steady motion.
Try to get the circulation and the heart rate. Try to get it back beating. So So before starting the chest compressions, we would put the person on his or her back on a firm surface, kneel next to the person's neck and shoulders, place the heel of one hand over the center of the person's chest between the nipples, place your other hand on top of the first hand, keeping your elbows straight and position your shoulders directly above your hand. Using your upper body weight, not just your arms, as you push straight down and compress. Compress the chest at least 2 inches. Push hard at a rate of about 100 compressions a minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical personnel take over. If you have been trained in CPR, go on to checking the airway and rescue breathing.
So that answers your question right there, the 100 compressions in a minute.
So now we go on to airway.
Which Desiree is going to demonstrate the proper technique to check the airway.
Okay, you're going to check and make sure that the airway is clear, and you're going to tilt the chin, lift the chin up, and then you're going to start breathing, get it mouth to mouth.
Don't. Okay, go ahead. I'm sorry. Go ahead.
And then you continue on doing the chest compressions, and then you're going to breathe in the mouth again and continue on doing chest compressions. Okay. You have to show me why this is different from this. If you are trained in CPR, you will perform 30 chest compressions. Open the person airway using the head tilt and chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward and open the airway. Check for normal breathing. Take no more than 5 to 10 seconds.
So you want to put your ear down to see whether they're breathing or not.
Right. Look for chest motions. Listen to normal breath sounds and feel the person's breath on your cheek and ear. Grasping is not considered to be normal breathing. If the person isn't breathing normally and you are trained in CPR, begin mouth-to-mouth breathing. If you believe the person is unconscious from a heart attack and you haven't been trained in emergency procedure, skip mouth-to-mouth breathing and continue chest compressions. Okay.
You have any questions?
So if they had a heart attack and they're unconscious from it, you don't do mouth to mouth?
No.
You just want to do the chest compressions.
Right.
Because the main concern in that situation is their heart, so you want the circulation to keep flowing. Okay.
Good question.
And the technique for the breathing is, first you want to make sure, like she just said, the airway. You want to make sure there's nothing occluding their airway, because then you can't breathe in their mouth anyways, because it's something obstructing their airway. In the event that you don't have the materials that I have right here, you would just do chest compressions instead of doing the mouth to mouth. But if you do have something to protect yourself with, maybe. Okay, so the proper way to do the breaths is to tilt the chin, cover the nose.
The chest
You were,
rise.
you were looking for the chest to rise.
It was, in case y'all ain't seen.
It did? Oh, it Okay.
And those breaths will correlate with the 30 chest compression. But you want to make sure that you look to see if the chest is rising. Is the next step that you're doing it right. And if it's not, then just do the chest compressions. Okay.
Did you do?
Okay. Okay. With the airway open, using the head tilt chin lift maneuver, pinch the nostrils like I just showed you, from mouth to mouth. Cover the person's mouth with yours, making a seal over their mouth so there's no air getting out. And give 2 rescue breaths. Give the first breath lasting 1 second and watch to see if the chest rises. If the chest does rise, give the second breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver and then give the second breath. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. And like I said earlier, if you do those steps and after 5 cycles, which is 1 cycle is the breaths and the chest compressions. So after 5 times doing that, if they not responding, you use the AED, but that's for a whole other day. Okay. Any questions?
What would the AED do for you?
It would restart the heart. It would shock the heart to try to attempt to restart it.
This is what it looks like.
Yeah. If you don't have that, you just keep doing CPR without it.
Okay, so
Lastly,
what we're gonna do is Miss Desiree has a crossword puzzle for you guys to do, and whoever finishes the crossword puzzle has a lot of words on it that is pertaining to CPR. We're gonna have you guys do that, and the first one done get surprised. And then after that, we're gonna have you all come up and practice doing the chest compression.
I'm on record.
Are you okay?
Can I start recording?
Am I got a pen?
Can I start recording?
Mom.
She don't know what she does. Where did they start? Look.
I am just gonna take over our table. No, not yet. Everybody don't have something to write it, so about 1 more minute and then we'll get. Don't be looking either. Don't be looking either.
Sit down.
You said nobody looking, do some cheating. Cheater, man. Okay, I'm just gonna rest
I
my
guess the people who just.
dude, he's gonna be head. Dude, the easy thing. You need one too?
Let me just. Excuse me.
Yes.
Oh, no, I heard my name.
All right, my name.
Okay.
You gonna watch no, I don't want the process.
1, 2.
That's how long I've been on ya. I need you right now.
That's how long I've been on ya. That's how long I've been on ya.
I'm nowhere close to you. I got nowhere close.
You're terrible.
I'm nowhere close to you.
I found 5. Where's 3?
No. Wait, there is another typo.
I'm about to turn up though.
You remember?
My what?
Found airway. Go.
Where's that one at? Because that's what I need. What you do? I heard you.
You so late. You cheated, Mabel. Cheated, bro.
I was looking for airway.
She had to talk to me.
I'm not cheating.
Anyone has found food though, you can help me out.
I said, can I move?
That's it.
32.
You need 2 more.
Okay, we got another giveaway.
I don't think 2 is on here.
I don't see that.
Exactly, I don't see 2. Don't give away. Don't give away 2. Don't give away 30. Don't give away 2.
Well, one you not gonna find, so we're gonna give it away.
Where?
Is it 30? Please.
Yeah.
Okay, so I need 2. I found one.
So everybody got 30 then. Just mark 30 on that you got.
2 not on here.
Okay,
I see a lot of TW
So
with
2 not
no
on here?
O's.
Because I'm done if it's not.
I said 30. Yeah. I'm done if it's up to 2 and 30.
2 is not on here.
Well, there's no 2W. Oh, I see a T-O-W. 2.
That's how you spell it.
That's toe. 2 is.
Oh, I thought you said TW up. 5 moments, bro.
If 2 is not on here, I'm finished. Me too, I'm finished.
We all
I don't think
I'm
2 is on
need
here.
30 and 2.
So everybody need 2?
Everybody.
Yeah,
Oh,
don't finish it. Please.
I mean, okay, I found it, but it's not like regular crossword way. It's like that.
Right.
Okay, so it's on here. It's on here.
It's
on here.
done?
Hey, can you help me?
You done?
Chill, bro.
You done?
You done?
And I started like 5 minutes after everybody.
It's cool.
That's the only way I
we
can
work
find
together, so we
That's
Oh,
the same
no.
way. No, it's at the top.
I finished.
Then I was.
It's not on there no other way.
So
Yes, it is.
It's just not
we all
on
here.
there. So y'all all won.
So everybody's a winner. We cheer you guys.
We just gonna split the candy.
Okay.
No,
Y'all did good.
They have to come up here.
They're not
to
gonna
show
get a piece
how-
of candy because you.
Okay, but y'all have to come up here. And y'all not gonna get away that easy. Y'all have to come up here and show.
Y'all either gotta do a chest compression, sweeping the airway, or checking for breath.
I do it.
Dude, chill. Hold it in, man.
I want to do the air.
Yeah.
So don't do far. Okay.
Thank you. So he's going to demonstrate the 30 chest compressions,
Alright.
proper hand placement.
Yeah, pump right here. 30 times, but I'm not gonna do it 30 times. Probably like I'm gonna do 5.
Okay.
So you hold your arms in tight. And 1, 2, 3, 4, 5.
That was good.
He knew how to hold his arm.
Right.
Everything.
We're teaching this.
You ready?
Wait.
Your turn.
Yes,
You gonna do the
sir.
chest compression?
Or you can do airway or breathing.
Well, I don't have another mask, but you can check the airway.
You don't hold the big arm. Do this.
Yeah.
Yeah, you just keep
Keep
your
it
arm
down.
straight.
My hand can't go all the way up.
You gonna try?
Demonstrate that.
There you
I'm doing it.
check the.
Okay.
You're supposed to put your hand on their forehead and then tilt your chin back.
Mm-hmm.
The 2 fingers.
Like that.
That was good.
Alright. What is called?
Well,
The
he
chest
didn't
pump?
finish like
No, what you just check to see
He said the chest pump.
Chest pump.
the chest compression.
Don't you pay attention. Can I?
Proper hand placement.
I keep putting my hand down because my hand hurts.
Okay,
Alright.
we'll do that.
Give me a finger.
Right here?
Yeah.
Alright.
You wanna have it
How many
like in
times?
between they.
Wait, honest, man. 30. Alright. Ready?
I do a demonstration. I do another one. I can do another one.
What you wanna demonstrate?
I do the chin.
Yeah, you gonna do the chin tilt, and then how do you do the finger sweep?
5.
No, the finger sweep,
It's
where you take your finger and you.
2.
No, it's the breaths are 2. So for the finger sweep, you will take your finger and put it down in their mouth, just to make sure they don't have anything obstructing their airway. So you do chin tilt like you were gonna do.
That.
And then sweep your finger in their mouth.
That was good.
Reflex, man. Off today.
Anybody else want?
Oh, I'm gonna try the thing.
Yeah, I got you.
I wanna try the thing for your cheek, no thing.
Okay.
Sweep like this.
Alright, so you would hold it, forehead, tilt it, head back, and take your finger, preferably your pinky finger because it's.
Ready?
You want to get in there and.
I'm not goofy. Do this. What's inside the mouth? If I do that.
Well, you want to be sure if there's anything down in their mouth, you can get it out.
Oh.
Anything that's blocking their airway.
That was good.
He said, oh, we're drunk.
It's got the baby chest compression. Okay. You want to try it?
want to do the chest compression?
Huh? You say, Mom?
At least I'm learning.
You place your hands right here. Arms and elbows straight. And then, there you go.
Like that. Okay.
You gotta
Okay.
Okay, so just an overview. So before you would start CPR, you would do what?
call
See if they conscious or.
Check
There we
level
go.
of consciousness.
Yeah. Say, are you okay? Are you okay? If you have another person with you, then you would either tell them to call 911. Say
Tell
it.
them to call 911.
Or
Start CPR.
right.
There you go.
And then if it's just you by yourself,
Start CPR.
call the
Call
police first.
911.
you call for help and
Or
then
call for help, whatever.
Yeah.
okay. And then you would start the CPR by doing what?
Start with the 30 chest compression.
Very good.
And then
Chin
what's,
up, then.
and then,
Oh, they want to blow your
Then two rescue breaths.
2 rescue breaths, and then after that what?
Repeat the cycle.
Repeat the cycle 5 times.
And then if it don't work, then
You use the
do that
AED.
Oh, look at y'all. That was the goal here. Okay, so we're gonna wrap it up now.
anybody have any questions?
I love it. You clapping for us.
All right. Thanks for watching, guys. Hope you learned something.
I can't clap with this in my hand. I stopped this.